Hello, my name is Ivan and this is my Chikungunya awareness video. Please be advised that I'm not in the medical field. However, I have recognized that the Chik-v awareness campaign is woefully inadequate and that in other cases, people really don't care to research the information. This information comes as a result of many hours of research, consultations with many doctors and herbalists, and interviews with even more Chik-v victims. Chikungunya is a mosquito-borne viral disease. The name chikungunya derives from a word in the Makonde or Kimakonde language meaning to become contorted or that which bends up, and describes the stooped appearance of sufferers with joint pain. Chikungunya fever has reached epidemic levels since 2004 as it has spread from typically affected zones in parts of Africa, Asia, and the Indian subcontinent to Europe and the Americas. I will now look on some important facts about chikungunya, commonly referred to as Chik-v. First thing we'll be looking on is the transmission of Chik-v. Chik-v causes an illness with an acute febrile fever phase lasting 2 to 5 days, followed by a longer period of joint pains in the extremities. This pain may persist for years in some cases. The disease is transmitted similarly to dengue fever to humans by virus-carrying Aedes mosquitoes, specifically the bites of infected Aedes aegypti and Aedes albopictus female mosquitoes. These two species can also transmit other mosquito-borne viruses, including dengue, as said before. These mosquitoes bite throughout the daylight hours, especially in the early morning and the late afternoon. However, the Aedes aegypti mosquito also feeds indoors. It is known that monkeys, birds, cattle, and rodents are animal reservoirs for the virus. What this means is that they can be infected with the disease and then pass it on to other mosquitoes, which later bite them. This is in contrast to dengue, which only humans and primates are host reservoirs for. Chikungunya cannot be spread directly from person to person. I repeat, it cannot be spread directly from person to person, but in very rare cases, the virus can be transmitted from mother to newborn around the time of birth. The onset of the illness usually occurs within 4 to 8 days of being bitten by an infected mosquito, but can range from 2 to 12 days. We'll now look at the signs and symptoms of the disease, which are common in other illnesses such as dengue, malaria, and even more alarmingly, Ebola. So here are the signs and symptoms. Sudden and high fever, severe joint pains, mainly in the arms and legs, which usually lasts for a few days or maybe prolonged to weeks, headache, muscle pain, back pain, and rash, which typically only affects 50% of Chik-v victims, nausea, fatigue, and it is important to note that the symptoms do not seem to come in any specific order, but rather it varies from person to person. According to the World Health Organization, most patients recover fully, but in some cases, joint pain may persist for several months or even years. Occasionally, cases of eye, neurological, and heart complications have been reported, as well as gastrointestinal complaints. In a family member, some form of mouth ulcer has occurred towards the back end of the illness. This seems to be rare, as I have only heard of 2 cases with persons suffering from this. This makes eating difficult, and a person may have to suffice with porridge or other liquid food until it stops. Serious complications are not common, but in older people, the disease can contribute to the cause of death. I have heard of a few deaths so far, one which has come very close to home. Often symptoms in infected individuals are mild and the infection may go unrecognized or be misdiagnosed in areas where dengue occurs. Prevention, and this is my favorite part. Since there is no vaccine for Chik-v infection, the best cure is to protect yourself from mosquito bites. In order to prevent yourself from catching the disease, you have to ensure that your arsenal is ready. The most important thing in your mosquito arsenal is your Zappa tennis racket. And here I have a very highfalutin one, um, which can be plugged in and charged. But there are also some which use battery, typically AA batteries. However, a friend of mine has told me that he has rigged it up to use a 9-volt battery. The racket is the only certain way to ensure that the mosquitoes are actually dead. There is also a pretty neat do-it-yourself mosquito trap, which I will show you in another video. After your mosquito racket, the second most important weapon in your Chik-v arsenal is your repellent. This ensures that the mosquitoes stay as far away from you as possible. Use insect repellents containing DEET, IR 3535, lemon, lemongrass, citronella, or eucalyptus oils. Here I have a bottle of finished off, finished off, which is now hard to find. I'm now using a cocktail of several essential oils and this bottle of lemongrass extract. I'm also taking B12. I think this is about 500 micrograms of B12, which is very good for keeping the mosquitoes away from you. I have also heard that the herb catnip is just as good as DEET because they say that prolonged use of DEET can cause some other complications. So you can also make your own mosquito repellent from essential oils and other recipes that are easily accessible online. Because you can't zap every living mosquito and you don't only want them repelled from you, you want them out of your space, you can also use vape mats and mosquito destroyers and the mosquito trap that I'll show you in another video. If you can mesh your windows or sleep under a mosquito net, that would also be good. Wear long sleeve shirts and pants as much as possible to cover your skin, but do not spray repellent on your skin under your clothing, as this may cause irritation. Some foods that have been recommended for Chik-v are peppermint and spearmint, garlic, sweet potato, watermelon, broccoli, lettuce, and oysters. I went to a function last night and I made sure to have a healthy dose of watermelon. This is supplemented by my regular mint and garlic tea, and I also cut up garlic and put it into my food. A couple weeks ago I saw my oyster brethren and bought half a dozen oysters. If you're in the corporate area, maybe a trip to Port Royal may be in order. I am inclined to agree that the government has handled the situation poorly by not cleaning and clearing drains. But we too, as citizenry, have an important role to play to keep ourselves safe. Mosquitoes breed up so fast that it would be impractical to fumigate, as we would be fumigating the whole country every 3 to 4 days, which really is impractical. But here are some things that you, as an upstanding citizen, can do to protect yourself, your family, and your community from Chik-v. You can destroy mosquito breeding grounds by emptying water from containers, such as old tires, drums, barrels, discarded containers, bottles, flower pots, saucers, pet dishes, anything that can hold stagnant water. You can scrub containers after you discard the water, as mosquito larvae may still remain alive in the dampness of the container. Um, you can cover trash cans so that they don't collect rainwater. Punch holes in the bottom of tins before placing them in the garbage. Help to clear blocked drains near your home. Alright, so if you have gone through all of this and then by some stroke of bad luck you still have gotten Chik-v, here is diagnosis and treatment. It is recommended that if you display any or all of the symptoms that I spoke about before, that you should go to your doctor, who would then order a blood test to confirm the presence of chikungunya antibodies. However, my understanding is that the test is expensive. To this end, since we are currently experiencing high levels of Chik-v to the point that it is being called an epidemic in Jamaica, it has been recommended in some circles that you simply treat the symptoms. Since there is no vaccine or antiviral medication available to treat Chik-v, doctors generally prescribe pain and fever medication. Now, listen carefully. It is advised that you only use paracetamol painkillers. And the painkillers that have paracetamol as the active ingredient are chiefly Panadol and Cetamol. And Panadine also has paracetamol, but it also has codeine in there as well. You are not supposed to use aspirin, which is present in medications such as Excedrin, and you are not supposed to use ibuprofen, which is present in Advil. So you're only supposed to use Panadol and Cetamol and Panadine. You're also not supposed to use any other anti-inflammatory drugs. I have heard people say that you're not supposed to use Cataflam because all of these increase the risk of bleeding because they are blood thinners. There is now a war of words among the bright and the intelligent in regard to the use of ibuprofen, with doctors saying you shouldn't. However, there's somebody behind the pharmacy establishment in Jamaica which says that you can. However, because there is the possibility of the risk of bleeding, I would suggest that you stick to Panadol and Cetamol, and Panadine if you can take codeine. Patients should also get plenty of rest. If your limbs are weak, do not attempt to walk, or if you can walk, do not overexert yourself. I heard recently that someone fell and hit their head, which led to bleeding, and this raised a scare that there was Ebola in Jamaica when it was actually Chik-v. Now, there are some doctors that are recommending that people use manufactured interferon to boost the level of interferon naturally occurring in our bodies. Now, interferons or IFNs are proteins made and released by host cells in response to the presence of pathogens such as viruses, bacteria, parasites, or tumor cells. In a typical scenario, a virus-infected cell will release interferons, causing nearby cells to ramp up their antiviral defenses. Therefore, taking manufactured interferons won't rid you of the virus, but will boost your body's natural ability to fight the virus. There are also doctors recommended the use of, and I'm going to have a little problem pronouncing this word. I heard the pronunciation earlier, but it has left me. I think it is acyclovir, which is a generic name, and it is also known by the brand name Zovirax, which are antiviral drugs that are used to fight chickenpox and shingles. There are some doctors that disagree with the use of these drugs to treat chikungunya based solely on the fact that they were not made for this. However, there are some doctors that are contending, and some very good doctors as well, are contending that uh, it would be good to use these both as a preventative solution as well as a curative solution. Um, Acyclovir can be bought for I think about $70 a pill, and I've heard that the whole treatment could cost you under $1,000. But I would suggest that you read further on this and you look out for an article by a Dr. Mills who speaks about this. I think also Dr. Parshad Singh also came in the media speaking about the use of antivirals used for to fight chickenpox and shingles, to fight chikungunya. Herbalists now, on the other hand, are recommending the use of papaya, what we know as papa leaves, as well as the bush called never die or never dead. Uh, I have heard from and spoken to several people that swear by the papaya leaf. I actually drank some this morning. Historically, it has been used to treat dengue because the papaya leaf juice has been shown to increase the blood platelet count and assist in the recovery of those with lesser complications from dengue and now more recently of people with Chik-v. The foods I mentioned earlier for prevention of the disease can also be used once you have contracted the disease. Uh, Garlic, mint, sweet potato, watermelon, broccoli, lettuce. The focus here is building back your body and your immune system after it has been compromised. It is recommended that you also take multivitamins uh, or multivitamins, tomato, especially um, in the B family, as well as minerals like zinc to build back your immune system. I have also heard scores of people say that they would never wish chikungunya on their worst enemy. And that really is some type of pain that I do not want to experience myself. I would like to thank the doctors, herbalists, and people that have gone through Chik-v for sharing this information with me so that I may share it with you. Be smart and protect yourself from Chik-v. And if you have contracted it, try to also be smart not to cause a spread in your area and also to build back your system after you have overcome the virus. I will also be posting some references so that persons may read further if or so that persons can read further as they should to be able to keep themselves abreast of the present and new information that is coming to us daily. Thank you.